Pat Nelson is our infection control person here at the hospital and handles infection control. So while we're still waiting for a lead, we're going to let her go next, all right? Do you need your notes? Okay.
Good morning, everyone.
Good morning.
Guess what I'm going to talk to you about today? I'm going to talk to you about hand hygiene, probably the biggest thing. No, that's not the right one.
That's not the right one?
No,
You
I
want
sent
the...
you.
Oh, I didn't get that. When did you send
I
it?
sent it to you a long time ago.
Uh-oh. Is that the one you used for...
I have it for me, but
Okay.
that's all right.
But they do have a handout on the
Okay.
On the day off.
Okay, I had a PowerPoint. I'm not sure what happened. I'm sorry, I don't know what happened to it then. The objectives for my talk this morning is that you will realize that I'm going to talk to you about hand hygiene. It's the single most important thing you can do to stop the spread of infection. And it will assist you. This is why we ask you when you go in to visit someone that you use the alcohol foam before you go in and then foam when you leave, okay? Also, standard precautions are used on all our patients, and what that is, I'm going to get into here in a minute. And there are disease-specific isolations here at Heart of Florida where we may ask you if you're going in to visit, you may have to put on a gown and gloves. Okay? So, the organisms that can cause infection, there's many different ones. There are, there's bacteria and viruses, fungus, parasites, and vectors. And examples of bacteria, you'll find the multi-drug resistant organisms. And everyone in here, even if you don't know a lot of the medical terminology, you've all heard of MRSA, right? So we unfortunately have our share of MRSA here, and when we have a patient who is MRSA positive, we do isolate them, and that's one of the circumstances where if you're visiting, you may have to apply gown and gloves. Another example of a bacteria is tuberculosis. TB is actually a bacteria caused by Mycobacterium tuberculosis. And when you go into that room, there'll be a sign on the door if you are visiting, and you will have to apply a mask, all right? We have funguses here, and funguses, we're in Florida, okay? Molds, fungus really do very well down here in Florida, and because of that, we have to monitor that. And occasionally, we'll get a patient in who has a lung infection, and it may involve a mold or a fungus. Viruses, another form of infection. Chickenpox is a virus. The common cold is a virus. Meningitis can be a virus. It also can be bacterial. So there's many different things that obviously you can come in contact with. I mentioned parasites. Parasites are things like lice and scabies. And we do see, unfortunately, folks that come in, they may have lice. If you're involved with children at all, they get lice in school, okay? You can get someone in from a nursing home who has scabies. And scabies actually is a little mite that burrows under the skin and lays eggs, okay? And it can be passed from people to people. Any of these that I've mentioned are going to be isolated, all right? Vectors. Vectors cause disease. Vectors are mice, for example, and mosquitoes. And as much rain as we've had, mosquitoes, all right? About a year and a half ago, we had a lot of eastern equine encephalitis, and this is caused by the mosquito, and that was here in the Lake Wales region of Polk County. There was a lot of that, so we do have that as well. So what is standard precautions? I talked to you about that, and standard precautions applies to all bodily fluids. So what we tell our people when they come is that we are protecting ourselves from you based on what is done to you. So, for example, we want to protect our staff. And so when they come, and when someone comes and registers, For example, they go to the registration desk, the patients do, and registration has no idea what's wrong with the patient. So if the patient comes in coughing, we have tissues there. If the patient is coughing severely, then we'll ask them to put on a mask. These are all forms of what's called standard precautions, and you want to protect yourself. You go in, for example, and you introduce yourself to a patient, you may shake their hand. And the patient may not be in isolation, but we all have germs on our hands. I'm sorry to tell you. Our hands are not sterile. So if I went up to you and I shook your hand, and you had maybe just covered your mouth with your hand for a cough or sneeze, you know, you have something on your hand. And again, I want to reinforce, that's why we ask you to wash your hands when you're finished with your encounter. Okay? So, hand hygiene, single most important thing you could do to stop the spread of any of those infections that I talked about. And the best thing is hand washing, but as I say that, if you go to the sink to wash your hands, you need soap, you need to use, turn the water on, and you need to use friction and get under all these places around your nails, around rings, anything that you have. And the minimum time you should be washing your hands is 15 seconds. And 15 seconds is a long time. Doesn't sound like it, but the next time you go to the restroom or something and you need to wash your hands, time yourself, and you'll see how long 15 seconds is. Okay? So, soap, water, friction. When you're finished washing your hands, get a paper towel to turn off that faucet, otherwise you've recontaminated your hands, and use that same paper towel to walk out the door, because that doorknob is everyone who didn't wash their hands. And trust me, there's a lot of people, unfortunately. Okay? So we recognize that that 15 seconds is a bit of a problem for some folks. And so what we do is we've installed the alcohol foam canisters. All right, there's one over here by the door, to give you an example. And we ask you to use that in most cases. It actually works extremely well. You go up to the canister, you put a dollop, quarter size or so, in your hand, and you rub that in. And by the time it evaporates, your 15 seconds is done, but you're still moving. It works great with our staff because they're busy. They can hit it and still be running down the hall. So please, that works very well as well. You know, you can use that in place of regular hand hygiene, or hand washing, excuse me. So when are we doing it? Before, again, reinforcing, before and after contact with the patient. If you have gloves on for any reason, when gloves are removed, obviously you want to wash your hands before you eat. You want to wash your hands after you use the restroom. And if you wear contacts, like I do, you obviously want to wash your hands before you do any of those kind of things as well. Or you could get an eye infection. Okay? So to give you an example, I often will take my shower, and then as soon as I get out of the shower and dry off, I put in my contacts, because I know my hands are very clean at that point. Now, I wanted to talk to you a little bit about what's called a bloodborne pathogen. Bloodborne pathogens are microorganisms present in blood that can cause disease. And they include diseases such as hepatitis B, hepatitis C, and HIV or AIDS, and/or AIDS. Transmission for a bloodborne pathogen is usually direct contact. It can be a sexual contact. It can be sharing needles if there's drug abuse. It can be between mother and fetus. And so we check our maternity patients when they come in to make sure that they do not have any bloodborne pathogens. It can be an occupational exposure. Anyone who works at a hospital or is here at a hospital could potentially be exposed to a bloodborne pathogen if there's any kind of spray or if there's a needle stick or anything like that. And I hate to say, it can be caused with body piercings or tattoos, and I know y'all have those. That was a joke, guys. Just kidding. But I mean, unfortunately, there are more and more people right now who do. Okay? It's very in style right now to have multiple piercings or body tattoos. And if people do not go to the correct place or get licensed to do so, you know, they could potentially be exposed to equipment that is not cleaned properly, all right? So, I wanted to mention a little bit about HIV because everybody gets concerned about that. HIV is the virus, bloodborne pathogen, that can cause AIDS. It enters the bloodstream and attacks the T helper cells, and the body then loses the ability to fight infection. It's transmitted through blood and bodily fluids, and unfortunately there is no vaccine, as you all know. So if you have a client or you come in to talk to someone who's HIV positive, there is no concern. You can go into their room. There's no isolation for that. It's standard precautions. Again, you just protect yourselves from their bodily fluids. So, you know, coughing, sneezing, you're not going to get involved with their blood. And coughing and sneezing is not going to be a concern with something like this with HIV. It's direct contact with blood. Okay, so no problem. Signs of HIV infection, just to let you know, is very flu-like. There is fever, weight loss, tiredness, flu-like symptoms that will eventually go away, but the virus doesn't. So someone who is a new HIV patient will have a heck of what they think is the flu. And they get better, but the virus itself just doesn't go away. Okay? So prevention for HIV obviously is abstinence, safe sex, and in this case use of latex condoms and spermicides as well. And then I mentioned before, we screen all our pregnant women, and it's actually a Florida statute that they get screened in their first trimester and their third trimester as well. So in order to prevent transmission to the unborn child, we follow through with that, and we give medicine immediately. And of course use standard precautions. Personal protective equipment we use here at the hospital. It's the use of barriers to prevent exposure. And it includes the gowns that I talked about. Usually they're yellow. You've seen them if you've been here. They're fluid resistant, okay? Masks and gloves. And the staff uses this depending on the task that they're doing. These items are applied before you go into the room. So if you're visiting someone, you go ahead and you put on the gown, whatever is recommended, and there will be a sign on the door to tell you. And I'm sorry I didn't bring the signs, but you'll see them on the door. They'll tell you to put them on before you go into the room, and you take them off as you're leaving the room. You don't walk down the hall with this same thing. And if you're visiting two people that are both in isolation, you need to remove that still and put on a clean one, wash your hands and so forth before you go into someone else, okay? Additional practices that we follow, I mentioned the isolations. We have the isolations are contact isolation, airborne isolation, and droplet isolation.
All right, thank you.
And examples for these precautions, airborne isolation is tuberculosis, for example, and chickenpox. Contact isolation is for your MRSAs or any diarrhea or scabies. And droplet isolation would be for anyone with pertussis, the flu, meningitis. Again, the proper sign will be on the door, and you can follow what the sign says, okay? Tuberculosis, I just want to mention, back in the 80s, we thought TB was pretty much gone. And I used to work for the health department back then. I've actually have a long history of being a public health nurse, as well as an infection control practitioner. And back in the 80s, they closed a lot of the TB units and things, and really thought TB was on the decline. And much to our, amazement, it's come back with quite a resurgence. And we see patients with roulette tuberculosis here at the hospital frequently. I will honestly tell you, and I'm knocking on wood as I do, because you know how that goes, that we have not had an active TB case in quite some time here. But we will isolate anyone that we think could have tuberculosis. all right? And so you will see that it is nothing to really be concerned with if you are following proper precautions. But TB, unfortunately, is back on the rise, and there is multi-drug resistant tuberculosis as well, unfortunately. And we do have a TB hospital, just FYI, we have a TB hospital here in Florida, AG Holly, and it's located down near Fort Lauderdale. And folks that have high resistance to tuberculosis usually end up in AG Holly. I will mention just on an aside that TB is the one disease here in Florida that can be court-mandated isolation. And what that means, and I can actually tell you firsthand, we had a patient here 2-3 years ago who did have tuberculosis, who was terribly non-compliant. And we had trouble while this particular patient was here, and I'm sure they had trouble on the outside, to the point that the police will get involved, get the courts involved, and mandate isolation, which in some cases could even be putting them almost like in jail to ensure that they don't go out and contaminate the community. So we do have that here in Florida. So I only had a limited amount of time. What I'm going to do, though, is I'm going to copy my slides that I just talked from for you, okay, since there was some, I guess, some problem with that, and ensure that you have this. I had some funnies in there, and I'm sorry you didn't get to see that because I was trying to keep it light as well. But yes.
I have a question regarding MRSA. I work with a 92-year-old couple in Osceola County, and it's taken me several months to get them out of their home and into an assisted living 24-hour care facility. My concern is I dealt with MRSA at one of the St. Cloud hospitals. He had it, she had it. They seem to be more stringent about it at the hospital, not as stringent in the nursing home. Do I have to worry, since the nursing home standards are not as high as the hospital, do I have to worry about how I carry it home on my clothing or on my shoes if there are? I'm concerned about the shoes. How long is this germ that gets spit on the floor or coughed on the floor alive for?
Not.
It's not.
No, and I want to reassure you, first of all, that MRSA, and everybody gets so worried about it, and I don't mean to belittle it, it's actually minor in the scheme of multi-drug resistant organisms anymore. There's much worse, in other words, out there. But MRSA is, what it is a resistance to a drug. Okay, so a lot of us have Staph aureus, that's the bacteria. A lot of us have Staph aureus on our skin. It's there commonly. And what has happened with MRSA is that this particular bacteria has become resistant to certain medications, and they're no longer able to be used to help it go away. So a lot of us may even carry MRSA in our noses, okay? And as long as it's there and does no harm, you kind of cohabitate with it. So the only time you have to worry about it is if you're actually sick with it. So yes, you could carry it home. I'm not saying you can't. But the biggest thing I want to reinforce is if you are doing proper hand hygiene, you're really going to be okay.
Somebody told me not to wear my shoes into the house. And I don't know if that was just a nurse that took it to the nines.
That kind of is.
That's a little over.
Yeah,
okay.
But I got to tell you, there has been more and more articles recently relative to nursing scrubs and saying how nurses do bring these bacteria home. That part's true. And I'm actually a proponent for maybe stripping in the garage, you know, going to that extreme, and possibly changing out. I like the whole idea of changing out. It has not, but again, I'm an infection control practitioner, and so I think a little more extreme probably than others. As long as you are putting on protective barriers when you're going in anywhere that has a contagious or infectious person, you should be fine.
Thank you.
You're very welcome. On this handout that I will make sure you have copies is my office and work cell number, and I'm not ignoring you. Just one sec. And so you can call me if you have any questions or if you're here. I have no problem with that. I could talk all day, but Skip won't let me. So I'm going to stop now, but take questions.
Yeah, I'm curious if you can give a rule of thumb, like the various causes of diseases like the bloodborne pathogen, the viruses, the bacteria, the fungus. How long do they live? How long are they active?
You know, everything has a different lifespan. One of the things I didn't mention because of the whole time thing, I was trying to stick to my time. Sorry, Lee. Well, you're late. You're late. But one of the things that I didn't mention was C. diff and Clostridium difficile, which is an infectious diarrhea, and it's usually caused. It can be caused generally by people taking excessive amounts of antibiotics, and it throws off the body's natural makeup, and they start experiencing diarrhea that then can become infectious to others. Everything I told you about the alcohol does not apply to a patient in C. diff, and I really should have mentioned that. You want to wash your hands. C. diff is a spore, totally different, okay? And all those cleaning agents don't penetrate the spore. The only thing that really they think kills C. diff is chloride, like a bleach derivative. And so C. diff can live a long time if it's not correctly cleaned. And when you are going into a room, if you are going into a room that the patient has C. diff, you must wash your hands. Washing your hands doesn't destroy the C. diff, it just makes the spores go away from your hands. If you're using the alcohol, you're never getting it off your hands. But when you wash your hands, you're washing the spores off. So you must wash your hands with C. diff always, okay? MRSA, any of those other things, regular cleaning agents will kill it pretty much on contact, okay? Hepatitis B is a bloodborne pathogen. It can live on surfaces for up to 30 days. So if not cleaned properly, you can be exposed to hepatitis B. Some of them are much shorter. AIDS, for example, the AIDS virus, when exposed to the air, dies extremely fast. Not really a concern. Hepatitis B is my biggest concern with bloodborne pathogens. Does that answer your question?
About things like, you talked about the handles in the restroom, things like that.
Well, I'm going to tell you, those kind of things, because of constant use, if you're in a general restroom where there's a lot of people in and out, I would not trust that at all. I would always use a paper towel to walk out, because unfortunately, people, if they know they're being observed, they will generally wash their hands at least a little bit, but there's a lot of folks still that walk out. I mean, I could stand outside a restroom and tell you, even in here, that there are folks that still do not wash their hands. So I would just be, make sure that you're using a paper towel to walk out after, always. Yes, sir.
Is there a number for your department?
Yes, I'm going to give you that when I make this.
Okay, good.
Absolutely. Yes.
What about sepsis? Is that contagious?
Sepsis?
Yes.
Sepsis is a condition. It's a condition where you have like a lot of different things going on, where you can have fever, you can have bacteria in your blood cultures, you can have a UTI. It's a condition, not necessarily something.
Even though it's listed, it's not an infection. Yeah, it's on here.
Yeah.
And also, once you've had it, are you prone to have it again?
Sepsis, again, once it's a condition of multiple things that are happening. And rather than a single event, like you can have, let's say you can have a urinary tract infection. A urinary tract infection with sepsis could be only one piece of it. So usually, I can't really answer that, because if you're more susceptible to getting certain things, you could always go septic from it. But it's not it's a condition rather than a single event, if that makes sense.
Yeah.
Anyone else? I thank you for your time, and I will make sure you get this. Thank you very much.
You got the sign?